The following program is rated GE. It is suitable for general family viewing.
Ladies and gentlemen, welcome again to Body Garage, the art of well-being. It's another Thursday and we're here to bring you discussions on health matters. And today we are going to talk about something that is very special and very important to all of us. We are going to talk about heart diseases. And just to mention a few that as we look globally, there are about 17 million deaths that are as a result of heart diseases all over the world. One of the common heart disease is the coronary heart disease, which is just but one of the types, and this affects about 200 million people, and majority of these, of course, being men. So in February 2024, we are looking to create awareness on heart diseases and specifically heart diseases in women. So for this discussion, we invite you to listen to this conversation today from our specialist, Dr. Gabala. Welcome to the show.
Thank you very much. This is the second time actually I come in Health Garage.
Yes, yeah, second time. First time we were discussing about hypertension.
Exactly.
Yeah, and that was quite a very impactful discussion. We had positive feedback from our viewers. Good to have you again.
Thank you very much.
Yes. I know you've been here before, but please take a few seconds to introduce yourself again to our viewers.
Okay, so hi everyone. I'm Dr. Gabala, the head of cardiology department in MP Shah Hospital in Nairobi.
If we can just start there, and so that we can understand a bit about the heart. Before we go to the disease, how does a normal heart look like? How does its structure look like? What are the functions of the heart? Yeah.
So even I work in many countries, as you said, but the heart is still the same. Like the heart of people in Africa is the same like heart of people in Europe.
In Europe, yeah.
There's some, on the same time, there is some changes and there's some difference, actually. So if we say that since I came to Kenya, I was actually surprised for the number of people suffering of hypertension. So almost in Kenya, it's 1 of 4 Kenyan suffer of hypertension, and only 25% of these people with hypertension in Kenya, they know that they have high blood pressure because they don't go for a routine examination like we do in Europe. So in Europe, every person have at least 1 or twice a year going for a routine examination or welfare package examination to go through different organs. And it's very easy to discover the high blood pressure. So the only thing is that you have to come to a doctor. Hypertension is the most common cause of death because it will lead to heart disease, and hypertensive heart disease is the most common disease among the cardiac panorama. So we see hypertension in many patients. It can lead to heart failure, it can lead to coronary artery disease, it can lead to different other problems.
Right. How important is the heart to the body of a person?
So the heart is just like a chamber, a muscular chamber. So there is a muscle around the heart. When the heart contracts, it gives blood to the brain, to the whole body, goes up and down, even to the little nails and the little toes. It gets blood. If the heart stops, we will die. All of us will die when the heart stops. Some of us will die younger, some of us will die at 90 years old. It depends on the health, it depends on how careful you are about the food you eat. There's different factors for that. But yes, the heart is the most important organ in the body. It causes the circulation to run smoothly, both to the lung, which is the right side of the heart, and then the left side of the heart. It pumps blood to the whole body, as I said. So the heart is, I would say that it is the most important organ in the body. So we have to take care of the heart a little bit better, I think, than we're doing at the moment.
All right, great. So basically, without the heart, the blood cannot move around the body, and if the blood is not moving around, then
we are not alive. Actually, the heart can stop sometimes up to 3-4 seconds without any problems. If there is a problem with the electricity of the heart, then it can stop for 3 seconds, and then we can put a pacemaker. Patient can faint sometimes if the heart is not pumping more than 3 seconds. But if it goes above 5 or 10 minutes, it becomes a cardiac arrest, and then we have to deal with it. I think the longest person that I had in my career, his heart stopped and it was 20 minutes. But he was underwater, and it was in Sweden, it was very cold, and the low temperature actually preserved the tissue of the body. So we managed to resuscitate him, and he survived, but he was young as well. So he was, as much as I remember, he was 25 years old. Yeah.
3 seconds seems like a very short time.
No, sorry, 3 minutes. 3 minutes. Yeah.
All right, 3 minutes.
Yeah.
So you can have 3 minutes, heart can stop.
You can have 3 minutes without fainting, yes. But some people, they don't manage more than 2 minutes. Other people manage 3 minutes. But 3 minutes is the border to say that this patient need a pacemaker or need to be saved by other means.
All right, we are going to talk about how to treat the different heart diseases later on in our discussion. But right now, let's just we look at some of the common heart diseases that that exist and that you do take care of daily in your practice. So maybe we can start off from mentioning a few, like the hypertensive heart diseases.
Yeah.
Yeah, and then the congenital heart diseases.
Right.
So let's start with the hypertensive heart disease.
So the hypertensive, as it says, that when we measure the blood pressure, it is elevated, and that high blood pressure, it reflects backward to the heart. So the heart, instead of pumping the blood which goes through the whole circulation of the body, it has to pump a little bit extra to overcome the high pressure in the blood vessel. So hypertension has nothing to do with the heart, but if you leave the high blood pressure without treatment, it will affect the heart, and then it can cause heart failure.
Yeah.
One of the things, if you look at all the disease within cardiology, they are anatomical disease, something wrong with the anatomy of the heart itself. So the heart consists of 4 chambers. The atrium or the fourth chamber, there's right and left, and then the ventricle, which is more important, right and left as well. So if there is a hole between the right and the left, then it will cause a little bit more volume overload of the heart, and the heart will not work properly. So this one of the congenital, it's called ASD, which is atrial septal defect.
Yeah.
That means that there is a hole between the fourth chamber of the right and the left. It could be the hole, it could be in the ventricle level, which is called VSD, ventricle septal defect. And both of them are congenital disease most of the time, and they need treatment. If they are too small, we can even leave them without treatment if they're not causing a big trouble. If they are too large, it will cause trouble by more volume going to one chamber, because the blood will be going between two different chambers and will cause a dilatation or enlargement of the heart, and it can cause heart failure. So those are the congenital, and we talked about the hypertensive. Then another group, which is coronary artery disease, which is a atherosclerosis, which means high cholesterol. So it comes from the diet, it runs in family, that some families, they don't have enough enzyme activity in the liver, so they don't get rid of the cholesterol. Once the cholesterol starts to increase in the level in the blood, it goes to the blood vessels and they start to build small notches inside until it encroaches on the lumen and ultimately can stop the whole circulation in that artery. If the artery going to the heart, it can cause acute heart attack. If it goes to the brain and the gut narrowing of the artery, it can cause a stroke or other problems, like even can cause bleeding sometimes. And these conditions should be treated as emergency. If anybody has chest pain, which is a sign of the heart attack, they have to come to the hospital. So we talked about congenital, and there is another group with women during pregnancy. And of course, because we are afraid of giving drugs to the pregnant woman, because it can go through the placenta and affect her baby.
Before we talk about the heart diseases in women, let's talk about the few that you've mentioned a bit more. When we come to heart disease as a result of hypertension, how common is this? Because you said there are so many people with hypertension and many actually go untreated for many years. How common do we find that hypertension has led to a heart problem?
It is very common. I would say in general, 25% of all admission to the hospital, it's because of heart failure or because of myocardial infarction or heart attack. And it's a large number. So every week, the last patient, it was early in the morning. He's 60 years old and he didn't know that everything was right for him, but we found out that he has high blood pressure and high cholesterol, and it causes heart attack. So there are different risk factors that makes this process quicker, which means that instead of having a heart attack like usual at 70 or 80 years old, now we have younger patient at 40 years old or 50 coming with heart attack, which is a more dramatic presentation to the hospital.
What are some of the things that are making this happen in the younger people? What are the risk factors?
The first risk factor is smoking. Smoking is really bad for the health. I'm not talking about cancer, but it can provocate this atherosclerosis, which means that the high cholesterol, even if it's normal cholesterol with the smoking, it will go and affect the blood vessel, and ultimately it can cause narrowing of the blood vessel. A sedentary life, people who doesn't do sport, they are more prone to develop heart disease, because heart feels better when you get your heart rate above 120 and then come down, which means that you have to do sport. If you don't do sport, you have a little bit inactive life, you will be more prone to develop heart disease. There are different factors, and of course one of the factors that we can't do anything is the family. So heart disease runs in family. We believe that there are genes that carry the trait of developing heart disease, and it runs in family. And those who get heart attack at age of 25, 30 years old, and they come to us, when we see that, we take some tests and we even do gene analysis to know what kind of gene, and we can even treat that separately. So pregnancy, we will talk about that, but pregnancy is a big stress for the women, and it can predispose to many heart disease as well. So obesity, high cholesterol, high blood pressure.
Wanasema wasemao kuwa elimu ni bahari haiishi kwa kuchotwa. Wakati mwingi natangamana na wanafunzi madarasani, sio kama mwalimu bali kama nahodha kwenye kipindi cha tasnia ya elimu. Na iwapo utanikosa madarasani, basi utanipata nyanjani nikisaka habari zenye usawa, ufasaha na ukweli. Na iwapo utanikosa nyanjani, bila shaka utanipata studioni hapa nikisoma habari na kuendesha mijadala mikomavu. Mimi ni Andrin Kilemi, mpenzi wa lugha ya Kiswahili na elimu kwa jumla.
They say money makes the world go round. So let's slow things down a bit. Put things in perspective. From the markets to the streets to the stocks, we make the complex comprehensible. Join me, Hibak Saeed, on TV47 Business News for market insights like never before.
The news that matters the most is the one that hits close to home. When disasters strike, we are there to inform you. When the bullets are flying, we tell you who's shooting and why. Reporting on you.
Welcome back. You are watching Body Garage, the Art of Wellbeing, and we are talking about heart diseases. Before the break, Doctor, you are talking about how alcohol predisposes to heart disease, and I think this is something important that we can look at more extent, because this is something that we commonly consume. You know, after work, somebody will go and have 1 or 2 bottles. You know, in the weekends, in parties and stuff. So you had mentioned that we use, just like we use alcohol to kill bacteria, something happens to the heart muscles as well.
So the heart muscle cell, the anatomy of the heart muscle is very simple, and it's very similar to even the cells in the virus or the bacteria that are killed by the alcohol. Once you drink, and it depends on the amount, if the amount is too large, it will come to the blood, and ultimately it will damage the small cells in the heart and small cells in the brain. So if you continue drinking, it can cause cardiomyopathy, which is a very bad disease. It has worse prognosis than the worst cancer that we know. So cardiomyopathy is a disease of the muscle of the heart. So the heart function, it goes down slowly until it reaches only 5%. So unfortunately, we lose a lot of patients because of alcohol. And people, they believe that alcohol only affected the liver, but it affected the liver, the brain, and even the heart. And people dies early because of heart problem, not because of liver problem. So that's why I want to actually, to stress on the hazards of alcohol on the heart muscle. So we know that cardiomyopathy is actually has very bad prognosis. Alcohol can even affect the cholesterol level. It can go up. It can affect the high blood pressure. It goes up, and it makes the situation worse, of course. So alcohol has a lot of side effects, but among those side effects is heart problem, which is a big problem for the community as well.
All right. So you've tied the issue of alcohol and cardiomyopathies, but I understand that there are different types of cardiomyopathies, which you've said it simply means that the heart muscles have become large and over time they fail to function. So is it right to say that most of the people that have a large heart muscle, the cardiomyopathies, most of them are the ones that consume alcohol, or there could be other causes?
There are other causes, of course. But imagine that the heart is just like a balloon. So the new balloon, it has like a tension in the wall. And once you start to inflate the balloon many times, the wall becomes weaker and redundant. And that's the effect that happens from the alcohol. If you stop drinking early, everything can go back to normal. But if it's too late, then the wall of the heart becomes thinner and it doesn't go back. Other causes for that, of course, heart attack. If there's a heart attack, it will affect the area of the heart and it starts to die. It's not contracting. And it depends on the size of the area. If it's too small, yes, the heart manages and regenerate this area and it gets better. If it's too large, then it will affect the contraction and they start to bulge out, the same like any balloon. Once the heart bulge out, it's too late. So we try with medicine, but as I said, the prognosis of heart failure is really bad. Like 50% can cause death without treatment in 6 months.
In 6 months?
Yeah.
All right. Now let's talk about, shift a bit more to look at heart diseases in women. And in this case, I would like us to start by talking about the pregnancy-related heart diseases, right? So there is something called gestational hypertension,
right,
eclampsia, and there is also peripartum cardiomyopathy. Let's start with the gestational hypertension. And
so gestational hypertension, actually, it's common because during pregnancy, the first 6 months, the blood volume increases by 45%, which is the peak. So like almost the women will have 1.5 volume of her own blood before pregnancy. It will happen during pregnancy, especially the last few months. And this volume have to find a place. So normally it will increase the blood pressure a little. But some women who actually have a family history of high blood pressure, they will develop high blood pressure during that time. Once they deliver the baby, the blood volume slowly goes down until the first 40 days, which we call peripartum period. After 40 days, the blood volume goes back to normal and the blood pressure, most of the time, I would say 90%, can go back to normal, and then we stop medication at that point. So the high blood pressure, yes, it is common, and we say that normally, if you count in Kenya, 1 to 4 people, if you walk in the street and you meet 4 people, one of them has high blood pressure.
Yeah, 1 in every 4 people.
In every 4 people in Kenya. And the same for women as well. So women, some of the women will develop high blood pressure, even at younger age. And we see the first sign that they have high blood pressure during pregnancy. So I would say, in general, I would say 60 to 70% who develop high blood pressure during pregnancy, they will continue and have high blood pressure later on in life.
Yeah, I mean, this is not your specialty, dealing with the pregnancy, but it seems like many of those cases are missed. What can women do to be able to catch this thing?
For pregnant women now, as a routine, once they get the first contact with the doctor, the first thing they do is to measure the blood pressure, because we know the comment that it is very common to have high blood pressure. And once they see that they have high blood pressure, they will start medication. We're still struggling with medication because until now we have medication which is very old, but we have to use them because those has been used for more than 30 years, and we know very well that they do not affect the fetus or the baby. So if, of course, the first priority is the health of the mother. If we see that the blood pressure is too high and we cannot control with conventional old medication, then we have to give them a modern medication and even take the risk that it can affect the baby. But the most important is to lower the blood pressure as soon as possible. High blood pressure, if it's untreated, it can cause abortion, it can cause a problem during pregnancy as well.
Let's talk about the peripartum cardiomyopathy, which you've already mentioned. Cardiomyopathy as enlargement of the heart muscles.
Yeah.
But in women, what happens that this heart can be
To say the
enlarged?
truth, it's a 1 million question, because we don't know the cause or the pathology of that. But a woman, a completely healthy woman, healthy pregnancy, and then suddenly we see that they start to develop symptoms with breathing problem, with chest pain, for example, or leg swelling. And then we do examination and we find that they have cardiomyopathy. So it can happen during pregnancy, especially the last 3 months. It can happen after pregnancy, after labor, when everything starts to go back to normal, but still they can develop cardiomyopathy during that period. After labor, of course, it is easy to treat because the baby has left the mother, but then we have to think about drugs which does not pass into the mother milk. So we have to accept only few medicine for the lady until she passes the period of breastfeeding, and then we can give her any medicine. Heart failure has actually, for the last 5 years, it was associated with a lot of development of new drugs. And that's why we have reduced the complication and the death of heart failure with the new drugs.
Now, let's talk about this one disease that seems to peak early in life and then maybe get worse, especially for women, the rheumatic heart disease. Yeah. What happens to this and how does it eventually affect the life of the woman?
So rheumatic heart disease, it's a group of disease actually, because most of the time it affects the valve of the heart. So we talk about the acute stage and the chronic stage. So it always, the acute stage starts at age of 12 up to 16, 17. And it always starts with a sore throat, like streptococcus infection.
In the throat.
In the throat, yeah, so tonsillitis, for example, or otitis media, pharyngitis, which is only inflammation of the throat. So the body starts to build antibodies against the bacteria to kill the bacteria. And as I said, there is a lot of similarities between the heart muscle and the bacteria. So the antibodies built by the body itself, they go and they start to attack its own tissue. Among them is the heart. It can even affect the brain, it can attack the brain, it can attack the kidney, it can attack the joints. And then it will develop over years until they get older, after age of 20, 25, or even 30, and then they start to get the damage manifested on the heart. Like for example, if they start to attack the valve will get tight and there will be very less blood, or it will cannot open and close properly and there will be a leak in the valve. And sometimes we start treatment at that time, but the best treatment is to have surgery or to change the valve. So the chronic stage, which is the rheumatic valve disease, it always manifests itself after age of 30 upward. It can come even at 50 or becomes manifested at 50. And at that time, as I said, so the valve is destructed, so there's nothing to do for the valve. Most of the time it ends with changing the valve.
So somebody might ask the question, a woman who has any type of heart disease, but in this case, let's say the rheumatic heart disease, can they get pregnant? Are they allowed to get pregnant?
Yeah, but it depends. As I said, so there's a group that they got pregnant, and then we discovered that they have a valve problem. Then the pregnancy, the whole pregnancy, they have to be supervised by a cardiologist and a gynecologist, which means that we have to discuss together in a big meeting with even the patient will be part of the meeting to see how long we continue with pregnancy. Because we know that the vulnerable period of pregnancy is the last 4 weeks.
Last 4 weeks?
Yeah. So sometimes we terminate the pregnancy 4 weeks earlier. So the baby is smaller in size, so it will be easy with delivery. And the blood volume is not as much as the normal pregnancy. So the heart, the stress on the heart is much less. So that one group. The other group that we know before that they have a heart disease which is not compatible, then we do counseling with the patient. If she has to use any contraceptive pills to prevent the pregnancy of happening. Some people, unfortunately, they don't listen, and then they go on and they get pregnant. Then we have to deal with them as the first group that we have to counsel. We have to do regular counseling. We have to do regularly check and to see what is the optimum period to terminate the pregnancy for both mother and the baby.
Wanasema wasemao kuwa elimu ni bahari haiishi kwa kuchotwa. Wakati mwingi natangamana na wanafunzi madarasani, sio kama mwalimu bali kama nahodha kwenye kipindi cha tasnia ya elimu. Na iwapo utanikosa madarasani, basi utanipata nyanjani nikisaka habari zenye usawa, ufasaha na ukweli. Na iwapo utanikosa nyanjani, bila shaka utanipata studioni hapa nikisoma habari na kuendesha mijadala mikomavu. Mimi ni Andrin Kilemi, mpenzi wa lugha ya Kiswahili na elimu kwa jumla.
They say money makes the world go round. So let's slow things down a bit. Put things in perspective. From the markets to the streets to the stocks, we make the complex comprehensible. Join me, Hibak Saeed, on TV 47 Business News for market insights like never before.
The news that matters the most is the one that hits close to home. When disasters strike, we are there to inform you. When the bullets are flying, we tell you who's shooting and why. Reporting on your victories, your health, your money, your security, your past, present, and future. We are interested in telling the stories of creativity, hard work, and resilience that you are known for. That is our job. This is my job. My name is Victor Moyakane, and it's my honor to bring you this news this way every Thursday night on the home of Untold Stories.
Katika majengo haya Hapa ndipo sheria zinapotungwa na zinapopakuliwa. Nitakuletea viongozi mbalimbali, mirengo mbalimbali, wote kwa pamoja wakipika na kupakua. Tutawapa nafasi kuweza kuangazia changamoto na mafanikio ya ugatuzi katika ukumbi wa siasa kila siku ya Jumatatu.
Welcome back. You are watching Body Garage, the art of well-being, and we're talking about heart diseases. So right now, Daktari, we have this group of heart diseases, maybe you can say coronary heart disease. Outside there, people say somebody had a heart attack, you know, but in the medical field, we know there is specific names for them, right? So let's talk about this heart attack issue and what that means.
So heart attack, or in medical language we call it myocardial infarction. It happens when the artery supplying part of the heart muscle gets blocked, so there's no circulation going to the heart. So the heart, as an organ, it contains blood, but it cannot use the blood inside the heart. The blood has to come outside the heart and then come back again to the heart. So if you imagine if the heart is just like your fist, and once the heart contracts, of course there's no possibility of having blood going through. So the blood has to go into a blood vessel which is outside the heart, so it does not get affected when the heart contracts. So if that artery gets blocked, so the area supplied by the artery, it will die, which means it's not contracting. It becomes fibrous tissue. And the nearby area of the heart, it will take over the function of this area which have the heart attack.
Yeah.
So what are the causes for the blockage of the artery? The first cause that we talked about is cholesterol. Simply, the cholesterol is high. It has to find a place. The first place to find is in the blood vessel. So it goes and build like a mountain inside the blood vessel. Start to increase all the time until it completely stop the circulation, and then it will affect the heart muscle.
Yeah.
And what make cholesterol high? Of course, the food we eat and the fat in the food, and even too much carbohydrate, it will be converted into cholesterol or fat in the body.
Yeah.
The second risk factor for that of happening, of course, smoking.
Smoking, yeah.
High blood pressure. And one of the worst thing is diabetes. And unfortunately, diabetes is very common among the Asian community and even the Kenyan as well. It starts to come now. Diabetes is very well related, especially diabetes type 2, very well related to the weight of the person.
Yeah.
So increase in weight, if you are overweight, you will develop diabetes. So age, of course, so it is a disease of elderly people, but unfortunately we see it in younger patients as well. But those risk factors, obesity, diabetes, hypertension, smoking, inactivity, less sport, alcohol, all these risk factors together, it will make that process of happening, and it can even happen earlier than usual. Yeah.
Between men and women, in your practice, who are more prone to getting these heart attacks?
Men are more prone for heart attack, as if God has created women to withstand a lot of stress, like pregnancy and labor. So labor and pregnancy is one of the biggest stress, like more than running marathon. So that's why a woman, until during the fertile older, they have actually 10 years protection against heart attack, which means if you have a woman who is 30 years old, she will be equivalent to a 20 years old male.
Are you sure?
Yeah, the study and the statistics as well say that. So the 10 years difference, it will immediately disappear if the woman start to smoke. So smoking will take out these 10 years. Then after menopause, both are equal, men and women.
Okay. On the risk of heart attack?
Yes.
All right.
Yeah.
Great. Now, I know you've mentioned a few here and there, but let's talk generally. What will be the symptoms for heart diseases overall, irrespective of the type? We can start with those that initially that look mild to the one where we have a full-blown heart disease. Yeah.
The first symptom is a chest discomfort. Sometimes we call it a chest pain, but people, they describe the pain different. And the perception of the pain is different among people as well, among women and men. Women sometimes have difficulty in expressing. Women tolerate pain more than men. So some people, they said, oh no, I feel I'm not right. I feel I'm unwell. And sometimes they cannot describe. So we have to make a lot of investigation until we reach the diagnosis. But chest pain is the most common symptom for the heart problem. And it's not every chest pain. So if you say that it's a pinpoint area, it is not from the heart. It is from the muscle of the chest wall. But the heart pain is involving the whole chest. It can goes up to the neck, on mostly of the left side, but it can even come on the right side. It goes to the left arm, the left shoulder, the whole arm, and even can go to the back or to the right side. It depends on the area. If it's a large area of heart attack, then the pain will be distributed across a larger area as well. The second symptom is breathing problem. So the patient, once the heart cannot pump, so there's a lot of blood stagnate in the lung, and it doesn't come back to the heart because there is two different circulation. One, the little circulation or the small circulation, which is from the heart to the lung, back to the heart, and then from the heart to the whole body and back to the heart. So the second symptom could be breathing problem. It could be even irregular heart rate, that you feel your heart rate is bounding and going fast or going irregular. Sometimes it manifests itself by only the patient faint. Because of the severe pain, he faint, and it becomes sweaty and they coming to casualty. And if anyone, and that's for the people who listen to us, if anyone get severe chest pain or even a chest pain more than 20 minutes, has to seek help immediately. Because the thing is, you come on time, we can save the heart. If you come late, like some people say that, I had a patient who actually told me that he had severe chest pain, but he came to the day after. Like after 12 hours, he thought that there's nobody in the hospital during night. So he waited until the day after. Every minute we lose a part of the muscle fiber of the heart. If we lose it, it won't come back. So time is very important, and time is the key for success. So if the patient with suspected heart attack comes on time, we save the patient.
That's great. So those are some of the common symptoms. But what happens by the time we are seeing somebody with a swollen legs, maybe the whole body is swollen?
If it's more chronic, yeah. So when we talk about the chest pain, it happens to people. People are sitting and eating or running sometimes, or doing any other activity, and then sometime and suddenly they get chest pain, and then it is severe. Then they stop, and this is acute. It happens on the spot. But if it happens over weeks or days or even months, then it's more chronic. So we talked about heart failure before, and heart failure, it means that the heart is not pumping blood and is not receiving blood. So if the heart doesn't pump, it will not receive. So there is relaxation, all the blood sucked into the heart. and then contraction, all the blood goes to the whole body. So if the blood doesn't go to the body, then it will affect the function of the brain. Memory loss or tiredness or sleepiness, that the patient sitting talking to someone and then fall into sleep. So those are symptoms of less blood in the brain. And less blood in the arms or the hands, it becomes very cold, and you can get sweaty as well, or we call it cold sweat. Those are symptoms as well. And then if we talk about that the heart does not receive the blood, so that blood has to go somewhere else. So the blood stays in the lung. So the lung, instead of filled by air, it's filled by fluid. And then they cannot breathe properly. So they get severe breathing problem. And that gets worse initially when the lie flat, so the problem starts to increase. So they can't lie flat, they have to put a lot of pillows underneath. We call that orthopnea, which means when you lie flat, you get breathless, you sit up. So they wake up in the night because of breathing problem, and they have to sit up. And if the blood goes to the legs and it stays there, it's not pumped properly, then it will be swelling of the legs. We call it edema. It can even go to the stomach and becomes fluid in the stomach, and make it worse even for the medicine to be absorbed or for the food to be absorbed. So all these are symptoms and signs of heart failure.
Mm-hmm. But the ones you mentioned now, you said this will happen when it is already getting to heart failure. It's been happening over a long period of time. But the earliest sign that somebody can use to recognize is chest pain or chest discomfort.
Yeah.
Right? Okay, great. Now let's talk about treatment. I know there are vast majority, many of the heart diseases, but if we can go through a summarized points on how people with heart diseases can be helped, how will we go about that?
So treatment of heart disease, of course, it's not one disease. We're talking about the whole cardiology, for example. So we start with hypertension, maybe. So hypertension, we treat the high blood pressure by different drugs. So the first group of drugs, which is the best, is called ACE inhibitor or A2 antagonist, like losartan or valsartan. All these tablets can help. Then we can combine that with water tablet as well. So the water tablet will lose some water from the blood volume, so the blood gets smaller and the blood pressure will get smaller. So there's another group called beta blocker. Mm-hmm. And even though we have to treat the cause, and recently in MBSHA we have a new technique to treat the blood pressure. It's called renal denervation. So we know that the blood pressure, the main problem for the high blood pressure that we don't know before, now we know that it is a connection between the kidney and the brain. Mm-hmm. By nerves. And those nerves, if we can destruct them, then the blood pressure after 4 months, it can actually go back again to normal, and we can stop the drugs. So the technique is called renal denervation, and we have it available here in Kenya in MBSHA hospital. So if we talk about the heart failure, so we have to go and first we have to know the cause for the heart failure. If it's alcohol, we have to stop alcohol immediately. If it is a coronary artery disease like heart attack, then we have to treat the heart attack, and we will discuss that later. But in general, heart failure, it can come acute or it can come chronic. Acute heart failure has worse prognosis than chronic, but the treatment most of the time very similar. So we give the same ACE inhibitor or A2 antagonist. So medications, yeah. And then we give diuretics, which is a water tablet to get rid of excess water from the body. We give aspirin. Aspirin, it helps the circulation in general in the body, in the heart, and in the brain. So we give aspirin, very common after heart attack or even after stroke. It helps. We look at the statin, we look at the cholesterol, and if it is high, then we have to give statin to lower the cholesterol. Then we give beta blocker. It will improve the contraction by lowering the heart rate, so the heart will have more time to fill with blood and then contract. So there are a couple of new drugs which came recently in the last 2 years. One of them is called Epinone. It's like a water tablet, but it works in a different way.
So what I'm getting is that you find the cause and treat, go to the medications.
Yeah.
Just briefly talk about heart surgeries. Do we do heart surgeries for heart problems? Which ones?
Yes. So if we know that the cause for the heart failure is blockage of the arteries, of the coronary arteries, and if the blockage are diffuse like everywhere, that if we have to open all of them, maybe we need 10 or 12 stents sometimes. Or if it is a complex to open the artery by stent, then we have to go to the other option, which is bypass operation. That we bypass the blockage by putting new blood vessels. Unfortunately, even those blood vessels, maybe after 10 or 12 years, might need another attempt to open, because if you don't treat the cause with high cholesterol, then it will come back again. If the problem is in the valve itself, then we have to change the valve.